Every year or two, the public health departments all do a survey of what are the needs. Dentistry in the rural and underserved areas always ranks very, very high.
At ECU, we feel like it's important to bring healthcare to people in rural communities just as people in urban communities should have it, because everyone is entitled to healthcare.
We have 100 counties. 85 of them are rural, 15 of them are urban. About half of the population lives in the 85 rural counties. We have 3 counties that don't have any dentists. We need to improve the health of the people in the rural and underserved areas of the state. Well, the first thing is to get the right people into dental school. When you look at patient populations in a rural setting, many times they may not have seen a physician or a dentist for 5 or 10 years.
Well, I want to return to the mountains because that's where my family is. And that's where I grew up and that's my home. They focus on overall health care rather than just dental medicine and dentistry, because we may be the first medical professional these people see.
Our facilities are brand new and our actual school itself is right around the corner from being complete, so we're all excited about that. It's state of the art, all the newest things you can imagine, but ultimately the commitment to service, to serving the underserved, the people that need it the most, that's what really brought me out here to Greenville.
But we're also, with our unique model of dental education, where we'll have our senior students out in rural and underserved areas in our community service learning centers in 10 rural communities across the state.
One thing that really attracted me to the ECU School of Dental Medicine was the community outreach, or the community learning centers, especially since one of them is about 15 minutes from my hometown.
You know, one of the other gifts that the state has given us is subsidizing the dental education. If you're coming in with $200,000, $300,000, or $350,000 worth of debt, there's no way you're going to be able to go out into a rural and underserved area where you may want to practice. What's going to happen is we're going to graduate students with low enough student debt to where they can afford to go back to a rural area and practice.